Good morning, everyone. Welcome. We're going to get started in just a minute while everyone logs on. Hello, everyone. Thank you so much for joining us. I'm going to give folks just another minute, and then we'll get going. Our attendee number is clicking up here. I'm going to just let it slow down slightly, and then we'll get started. Okay. That's slowed down enough. I think we'll get going. Hello, everyone. Thank you so much for joining us today. My name is Katie Pelletier, and I'm Senior Manager of Programs and Conferences at Southern California Grantmakers. Our mission right now in response to COVID-19 is to mobilize philanthropy to respond rapidly, effectively, and equitably to the COVID-19 pandemic by fostering inclusive collaboration, learning, and bold action. For those reasons that we've started these weekly funders discussion calls, we want to thank you all so much for joining us today for our second of our weekly calls. Before we dive in with our speakers, I want to share just a quick high-level overview of the work that SCG is doing beyond these webinars to support you all as our members in response efforts. We're working closely with partners at Northern California Grantmakers and San Diego Grantmakers under the umbrella of Philanthropy California, and we have assembled a comprehensive kind of micro website of resources, which my colleague is going to post a link to in the chat box here. There you can find all sorts of information, vetted funds at the local, state, and national levels. We have a search filter functionality so that you can kind of sort through the different funds that have been set up to meet your needs or your mission or your geographic focus. We also have a new public policy page on that site to help you understand the many different legislative and government responses. Our public policy team, Seiran, who is here with us today, has been hard at work helping make those connections between government and philanthropy, and we want to serve as a resource to you in that way. Our team in general across all of SCG is really engaged in this effort and standing ready to support you in your work, help you track down resources, answer questions, etc. So I really encourage you to think of us as a resource and reach out to us if you have needs or specific questions that you want help answering. So after last week's call, we surveyed all of you who had joined us to ask how we should structure these calls going forward to make best use of your time. And we heard from folks that this case study approach, where we really peel back the layers of what folks are doing and do kind of case studies of different members and organization responses, was really helpful. So we're going to keep doing that until we hear otherwise from you all about what would be useful. We also heard that organizing these calls under kind of topic areas so that we can go a little bit deeper in specific areas of need is useful. So for that reason, we're organizing around our calls going forward around specific issues. So still keeping it somewhat high level, but this week we're hearing case studies of folks who are all responding to issues related to the social safety net. And then next week, our topic is going to be nonprofit resilience. So I'm going to share a little bit more about next week's call at the end, and I hope you'll stick around for that because we actually have an ask of all of you. But for now, we plan to host these calls at least through April, every Thursday morning from 9 to 10 a.m. And we hope that these calls can be kind of a grounding anchor point for your week, where you can hear high-level overviews of important issues that you need to be aware of, get your brain thinking about questions you need to be asking of your own partners and grantees, learn about work happening by your peers, and then after and between these calls, SCG is offering a variety of deeper dive conversations and programming. So I'll share at the end how you can plug into that as well. So now we're going to transition to today's call focused on the social safety net. We're going to hear from 3 different organizations who are engaged in response efforts. And then my colleague Seiran is actually going to provide a quick policy briefing that's related to nonprofits that we want to share with you all ASAP. The bill just passed last night. So we'll have our speakers each share for 7 to 10 minutes, and then we'll transition to a Q&A. All attendees are on mute, and so if you have questions, please insert them into the GoToWebinar chat box, and we'll try to get to as many as possible. over the end, at the end of the call. And then the other thing I wanted to share is just that I know that all of you on this call, we have over 120 of you, are doing incredible and important and critical work as well. And so if you have work that you want us to be lifting up that you're doing, whether it's a press release or a link to a webinar that you posted or other things like that, feel free to post those resources in the chat box also, and we'll compile all of them and share them out with all of our attendees. We really want to be able to kind of crowdsource updates as well. So feel free to post those and we'll make sure that folks know about it. With that, I want to turn it over to our speakers today who are working across Southern California to support our social safety net in this really critical time. Joining us is Michael Flood, President and CEO of the Los Angeles Regional Food Bank, Javier Hernandez, Director of the Inland Coalition for Immigrant Justice, and Ann Sewell, Vice President, Health and Housing for California Community Foundation. And we also have my colleague Seiran Fu, who is Vice President of Public Policy and Government Relations at SCG. Thank you all so much for joining us today. Michael, let's start with you. Can you give us a quick overview of the LA Regional Food Bank for those who might not be as familiar, and then share with us how you're responding?
Sure, thank you, and thanks for the invitation to present today. For those of you who are not familiar with the food bank, we've been around, founded in 1973. Food banks around the country have been focusing on the issue of surplus food, what we now call food waste, since our beginnings, accessing perishable food, frozen food, shelf-stable products. And the initial model was distributing all this product out to a network of agencies, which for us in Los Angeles County is 600 other agencies, partner agencies. About half of those are faith-based and about half are 501c3 nonprofit organizations. And that work continues year-round. Food pantries, soup kitchens, shelters, boys and girls clubs, senior citizen programs. Really, it's a nonprofit network serving people in need. I'm going to speak to LA County needs and what's going on here because that's the area we cover. I know we have funders, I'm sure, who cover Orange County, Inland Empire, and other areas. So we do work very closely with food banks throughout Southern California and also throughout the state and nationally. But for my remarks, I'm going to be focusing on Los Angeles County. On a normal time basis, there are about 300,000 people who receive food assistance through this network of agencies and through some of our direct service programs to seniors, families, and kids. Things have spiked pretty significantly in the last 2 weeks. Initially, when the first coronavirus COVID-19 case was reported in LA County, right at the very end of February and beginning of March, the initial requests were for families who are quarantined or self-isolating, working through LA County Office of Emergency Management. And then also actually nurses and healthcare providers who, when the panic buying was at its peak, were working long shifts and finding that they couldn't get specific food items for their family and their kids. So initially, I would say the response just in that first week was, fairly targeted and low. And then once the layoffs and hour cuts hit, it has been a huge increase in the demand for food assistance throughout Los Angeles County. Just last week, our distribution hit a record 1.6 million pounds of food out the door. That's the equivalent of about 1.3 million meals. In a meal equivalent standpoint, I think most of you probably know the food bank, while there are meal programs we're a part of, a lot of this food is going out perishable, frozen, shelf-stable food, so that then food pantries, soup kitchens, and the like can either put grocery bags together, food packages together, or prepare meals depending on what their program is and who they're serving. So this is a significant spike when we look at it compared to that same week in March a year ago. It's 38% higher, and this week is as busy. One of the programs we also run is what's called Mobile Food Pantry, where we go to sites where we know there's need, but there isn't one of our partner agencies nearby. So that's an ongoing program, but that program now has transitioned to a drive-through program. The food bank and our agencies are viewed as essential services. We're open. I'm here today. We're very busy. And again, we're following all public health guidelines and directives and social distancing and all the other things to make sure we're doing our part to not allow this virus to be transmitted. So those distributions now through a drive-through basis have been massive. They've been running 700 to 900 families in a 3-hour period. We've done several in conjunction with the LA Federation of Labor, because they're hearing from many hospitality workers, service workers, and others where their hours have just gone to zero. They may either have laid off or not officially laid off, just have no hours or very, very minimal hours. So we actually have a distribution tomorrow where the Federation is telling us they're expecting 4,000 families to come through. So average 2.5, 3 people in a family, that's about 12,000 people just in one drive-through. So again, the idea of those distributions is to augment, take some pressure off our partner agencies who are also definitely feeling it. I don't have people served numbers because that data lags, but that's why I'm providing you the volume numbers, because that's something we can track hour by hour. So that's why I'm providing you those numbers. We've had 50 agency sites out of 900 sites in LA County suspend services. Most of those are faith-based organizations. I think some of the directives have been a little bit confusing, because for some faith-based organizations, they're being told, well, all of them are being told not to hold services, not to congregate. So we're letting and educating those providers know that actually your food program can continue if it's following those guidelines. And then we have a very large senior program, and I'll put this kind of need out there. We've talked about last mile, and we do a lot of delivery to our agencies and all these senior sites for seniors to receive food packages, about 28,500 on a monthly basis. And now we're talking about very last mile issues, home delivery. So we're in conversation with, again, you know, who you would expect in the private sector, who does a lot of home delivery, some very big players there, the LA County, City of Los Angeles, others, because again, this has been a major disruption where now there's quite a bit of unused, really trucking, and you know, it's just, again, been this sudden major disruption. So we're having those conversations in conjunction with LA County, the city, and actually one of Ann's colleagues, Alaa, at the California Community Foundation. So it's been very helpful in identifying, again, who could provide help, who could provide services, given the directive that especially seniors, we're all again, need to shelter in place unless we're doing something essential, but seniors, obviously, it's a big issue. And then the other thing I just mentioned is school districts. So now that school districts are clearly going to be closed for a longer period of time, officially to the beginning of May, but I think we all realize very likely for the end of for this entire academic school year. We had distribution in conjunction with LAUSD at Hoover Elementary School, just near downtown. That was actually more for LAUSD employees. We had 720 families come through in a 3-hour period, and we'll be starting most likely next week, augmenting the grab and go distributions that LAUSD is doing, because we know it's great they're getting a lot of meals out there, but technically those are just for the kids. And we know adults, parents, guardians, grandparents, that there's definite needs in a lot of those families that are beyond the meals. So that plan is getting finalized either today or tomorrow to augment those grab and go distributions with basically just a substantial amount of additional food for the family. About 30 meals with each of the distribution is what we're looking at in that regard. The food bank, we partner with 211. I know they're dealing with call volume. They're doing a terrific job. People can find food assistance on our website. We have a food pantry locator, and volunteerism has dropped, but has come back some now that people are looking for things to do. And I know I'm running out of time, so probably the last thing I'd mention is we're really looking now at short, medium, and long term with regards to this response. We're in the short, immediate term right now. I can't tell you exactly when it's moving into medium term. There'll be some blending there. It'll be kind of dependent on the segment we're serving, whether it be schools or the seniors or families, whatever the case may be. But we're thinking in those terms because I think we all realize this is going to go on for a while, and it could go on to the end of the year. It could go on to 2021. So we're starting to think in those terms with regards to, you know, we kind of obviously know what our short, immediate term needs are, and getting good support. Thank you to some of you on the phone who provided that support. And now especially thinking, okay, what does this look like, you know, into May, into June, into the summer, right, when kids are typically out of school, and if it goes long term, what does that look like? So again, I'll stop and again, I know we have Q&A a little bit later, so thank you very much.
Yeah, thank you, Michael, for your work and for taking the time to share with us. And if anyone has questions for Michael Flood from the Los Angeles Regional Food Bank, feel free to enter those in the chat box, and we'll get to those towards the end. Next, we have Javier Hernandez, who is the director at the Inland Coalition for Immigrant Justice. Javier, thank you so much for joining us today. Will you give us a quick overview of the coalition and then share how you're responding and what you're hearing?
Yeah, hello everyone. Good morning. My name is Javier Hernandez, director of ICIJ, or the Inland Coalition for Immigrant Justice. We are a regional coalition in the Inland Empire. We convene over 50 organizations on a monthly basis to work to improve and advocate to improve the lives of immigrants here in the Inland Empire. And when this I think Michael hit a lot of great points of like the first weeks. It didn't seem as as real for our communities, and then we saw second week, third week now, folks are really we're starting to see the need. And one of the first things that I want to share is we are working with folks that are really vulnerable. We're working first with people that are inside of detention centers, and that's one of the hardest, most vulnerable communities, because there are, it's 1,940 detainees at the Adelanto Detention Center. And the first thing that the detention center did, it's a private detention center. They locked down the facility, so people that are detained couldn't get visitors anymore. Even visits with their attorneys are they're shorter than usual. They only get 20 minutes to see an attorney now, and it's their own attorney. So one of the first needs that we saw, and this started right away when folks started reaching out to us that were detained, was the fact that they started feeling isolated. They didn't have money to make phone calls to their family. It gets really expensive to make those phone calls. One other interesting, and I guess it's in a way it's a good thing. The people detained get an iPad for 1 hour a day, and they're able to make video calls. But the video calls are even more expensive, obviously, than the phone calls. And so a lot of them were just asking if we could send money so that they can connect with their families, right? If we send them $20, the system is set up where we send $20, we have to pay $11 on top of that just to send them $20. And so we were able to do that, and we have a small commissary fund, but it's starting to dry up, and we're asking folks to donate into it, but unfortunately, we're not able to keep up with the capacity to be able to share with folks detained. Another quick, immediate need that we saw was, folks that are detained. A lot of those folks have bond, however, they're very high. We looked at 8 of our most pressing cases that folks that are over 60 or that have health issues, and we said, let's prioritize those cases, and actually to try, we said that to try to get them out, that's over $250,000 to pay for their bonds. And obviously we don't have that kind of support. So what we did, we started a bond fund, and this week we might be able to get one person out. Next week we'll be able to get one person out, that's really in need of this support, to be out because they are at risk because they're detained. But even with that, one of the, we've been calling on the state, on local governments, and also on the national government to release everyone that's at risk of higher contraction rates. And as we're calling for this release of folks, we did see a response last week where we were, ICE released about 7 people in one day. And so we went from, release folks to, oh, now we have people released and now we have to provide services to these communities. So it was finding housing, finding transportation, finding food, it became like, a quick moment of, okay, we're advocating for folks to be released, they're getting released, now what do we do? And so we're in the stages of, if we get, if we start getting release of folks, we're thinking 20, 30 people in a day. If we are successful in this campaign, we're going to need, housing, we're going to need pretty much like a shelter situation. And so and again, even that puts people at risk, right, when they're in a shelter. So we're working with local governments and local organizations to see how we can, if this happens, how we can quickly build something up where we can house folks, keep people safe, and also provide some healthcare services. The other thing that we saw was, now folks are calling us and asking us for, very specifically, we have a fund that helps people that have family detained, and we would prioritize the cases that we were working with, folks that were detained, and they would call us, their family would call us on the outside, and they would say, we need money for rent, we need food, we haven't paid our our bills, and we would be able to support with the minimal amount. When it came to food, we were able to provide more food. However, we're running out of food. We had a small pantry, and we had about 3 in different locations, and at this point, they're also drying out. And the problem is that we can't necessarily go and buy food right now because there's no food. There's no food at the stores, and that's that's what we're seeing now. And then also our fund, our humanitarian support fund, it's also drying up, right? And so before, where we were able to ask community to donate, now we're seeing that folks are more hesitant to donate because everyone is having need. Everyone is starting to see that there will be need in the long term, and so that's another area of work that we're seeing, and some advocacy. We're doing advocacy on that. What we're working on right now is because there's no mandate from the state on evictions, we're going city by city, which is very difficult. So we're actually now trying to focus on the county to see if the counties, San Bernardino or Riverside, can actually do something and put a moratorium on evictions for the next few months until we figure out how, what the long-term effects of this is actually going to be. The next thing is expanding county services. These counties have resources that they can tap into to give more services to immigrant communities. San Bernardino County is one of 11 counties that doesn't provide a health program for undocumented folks. And so we're saying, for the sake of public health, maybe this is the time to write something up and put it in the books, to respond to this emergency. And then when a few weeks ago, when we started seeing that there was going to be a need for food, we called food banks throughout the Inland Empire, and a lot of them were at churches, and they would require ID. And so it was a simple phone call to just say, hey, maybe right now, maybe it's impossible to not ask for an ID, because there's going to be need. And it was easy. Folks were like, they understood the situation and they said yes. And so that was something that we were able to do as well, and working with some of these food banks and now connecting folks to them. But I think one of what we're seeing now is folks are calling and asking us, they want to know what their rights are as workers, as renters, where the nearest food bank is, and how they can get healthcare. And it's, there's a lot of layers there. And so we're trying to see how we can actually, and we are there. We're working on a comprehensive resource guide. And what we want to actually do is kind of like looking at the 211 like model where people call in, with our partners, having maybe like a 211 type of model, where for a day, we get our partners and we go to the radio station, we advertise a phone number where people can call in. It's very specific, immigrant communities, and then we're able to then give them those resources. We're able to direct them to the food banks nearest to their communities, because we're hearing that folks don't want to call for support. They don't want to call. They think 211 or other services are services through the state or services through the federal government, and they're still concerned about the public charge rule. and they don't want to be subject to the public charge rule. And those are definitely things that we're addressing with the community. We're letting them know that, seek services, seek medical care if you need it, and educating them that, public charge will not apply in this situation. But at the same time, we want to make sure that folks have other services that they need, right? So unemployment, some of them are asking, how do we apply if we're undocumented, which you can now through California, but they're not sure how do you even fill those documents out because they've never had to do it before. They've never got the opportunity to do it before. I think it's a better way to state that. And then also, we want to make sure that we're being culturally competent when they're calling, and being able to understand, the immigrants with the different layers of identities and, and just different layers of need that they bring, that we're able to then answer that if they call us. So yeah, those are just some of the things that we're hearing, and I just want to emphasize that. I think what Michael said, right? It's the first weeks people weren't really preparing. I think now folks, especially I think for immigrant communities, what we're seeing is that they're trying to prepare now. They're trying to buy food, and there's nothing. And I think that's there's fear and panic now that we're seeing in immigrant communities. And then even for those detained, they're on lockdown, they're in isolation, and they're just they're some of them are like just ready to just sign their deportation because they don't want to be kept in isolation. They're even scared, and I think this is real. They're scared that they're like, we're detained, we're all in here. They're like, but the people that work here are going out and coming back in, and they're like, we're not sure if they're actually bringing something in, to us. So yeah, there is panic, and I think we need to plan for to be able to meet that need with information and with resources to our community.
Thank you so much, Javier. I really appreciate your work and sharing it with us. Last, we have Ann Sewell from the California Community Foundation. Thank you so much, Ann. I think folks probably familiar with the California Community Foundation, but if you'll give us a quick overview and then share about your response.
Yeah, good morning. Thank you, Katie. Good morning, everybody. The California Community Foundation is actually Los Angeles's Community Foundation, misnamed 105 years ago, and it just stuck. So we honor history. And we primarily, our focus in our grant making program in the last 10-year plan has been around education, immigration, housing, and health. And our discretionary grant making gives in those areas. Our donors, of course, give globally and give to a number of things, and have historically been really generous and concerned during disasters. We saw a lot of response during the wildfires a year ago, response during Superstorm Sandy and Hurricane Katrina. And we're seeing a really strong response this time from our donors. The public is behaving a little differently, and that's interesting. We are not seeing as much response from those envelopes with $50, $100 that we saw during the wildfires. And it may be, as Michael and Javier were talking, people are uncertain, themselves. They're not sure how long this is going to last, not sure what the economic impact is going to be on their families. But in the 2 weeks since we put up the COVID-19, response fund, we've received about $9 million from primarily, our own donors, and we've invested quite a bit of our own sort of grant-making reserves. We set aside some every year for unexpected needs. And we last week approved $1.7 million in grants, primarily to housing and homelessness, to health clinics that are sort of the front lines for, especially for people who are uninsured, which in LA County often means people who don't qualify for Medi-Cal because they're not documented. And then also in education to help connect those families whose children are not at school anymore and who have needs for access to food and childcare and academic supports. And we've also significantly expanded our giving to nonprofits that are, historically we've had this program called Pass It Along that we give to about 23 nonprofits that through their case management work, Venice Family Clinic, St. Anne's, different groups all around the county who do hardship grants to individuals to pay for rent, to pay for food. When a temporary solution to homelessness became safe parking, we started allowing people to use it to pay for, car registration and things like that so that they wouldn't lose access to their cars. But generally, it's a short-term, one-time grant to individual families. And we've significantly expanded that because our donors were really interested in that. So, so those grants went out this week. We're thinking about, the next round 2 and into the future of grant making. What does that look like? As listening to both Javier and Michael, we know that there are short-term needs that are changing every day. Can't get access to thermometers. Okay, we found the thermometers. We can't get access to food. That's opening up lumpily around the county. So how do we really look at those rapidly changing short-term needs as the virus, spreads throughout vulnerable communities? And then really, this is 2 kinds of disasters. This is an economic disaster as well as a medical disaster. And that is going to hit, I think, even harder than the Great Recession. We're going to see, depending on how long this goes on, we will see tremendous long-term economic impacts. And so how do we, which are going to hit the most vulnerable and the folks that have been working, the gig economy and hourly wages for, it's going to be something that we really need to think very strategically about. How do we put the advocacy pressure on? As listening to Javier, philanthropy can do a lot, but one thing that philanthropy can do is, start sounding the alarms when it's like, this really needs to be a job for the federal government. And so, yeah, it's great that, we can see an increase in unemployment payments and access, the increase in the number of people who qualify for unemployment, but there still are a lot of people who are left out because they were self-employed or, something like that. So how do we expand those sorts of resources and really think about what this is going to look like over the long term? We've been asked a lot. There are a number of funds that have been created. The Community Foundation has created a fund. Our partners at United Way have created a fund. The mayor's office has a fund that they've been actively fundraising and working on. And so our donors ask us questions like, why are there so many funds and which fund do we give to? And our answer to that is, it doesn't really matter. We each have different things that we are focused on, and we can describe those to you. And I realized as I've been talking to our grantees, we started this process by scanning all of our grantees that we work with, like in housing and homelessness. There's probably 34 of them that we convene every quarter. We talk to them every month. Where it's going out and saying, so what are you seeing? What do you need? Same thing in health, same thing in education, same thing in immigration, and it's getting those reports back all the time. Having multiple funds is hard on them because then they have to go to multiple places. So we're trying to really reduce that burden by coordinating as clearly as we can with our partners. We have a Monday morning meeting with the Mayor's Fund and United Way and CCF, and we have really been trying to say, let's clarify for the public and the grant-seeking public, what we're looking at. So United Way, for instance, started, although they, like us, they are trying to be very responsive to changing needs. One of the things that this crisis did is close down so many resources that people who are experiencing homelessness use. You can't shower at the gym anymore because the gyms are closed. You can't go into the libraries are closed. So United Way was really trying to stand up, hand washing stations and more resources for people around, encampments and stuff like that. And now is really working on getting shelters going that have the medical staffing that they need for people who have tested positive and are, not sick enough to go into the hospital, but need a place to be quarantined and isolated. So they've been focusing on that. We've been really focusing on thinking through the issues of sort of advocacy around payment of rent and working with supportive housing providers and housing providers who are finding themselves the first responders with all of their clients and dealing with that last mile issue that Michael's talking about food and childcare and things like that for people. So, one of the questions that was asked is how can Southern California grantmakers support our efforts? A lot of the members of Southern California grantmakers have already contributed to the fund. The fund actually has two components. There's a COVID-19 response fund that CCF is putting out through our usual partners, and then there's a partnership fund with other foundations that have come in and where we're working together on those things that collectively we think will make the biggest difference. So contacting us if you want to know more about those would be helpful. And I'll wrap up there.
Great, thank you. And we'll be sure to share contact information for all of our speakers with attendees if you're interested in following up. Thank you so much for your work and for sharing with us and for your coordination with other funds across the county and region. Last but certainly not least, my colleague Seiran Hu, who is our Vice President of Public Policy and Government Relations. We heard Anne speak a little bit to the importance of policy and advocacy, and we will definitely be using a future one of these calls to dive deeper on that topic, but wanted to provide a quick update on relevant federal legislation that our members should be aware of.
Thanks so much, Katie. Good morning, everyone. SCG's public policy team organizes our community to develop and strengthen philanthropy's voice in public policy. And so we wanted to share a quick update with relation to the bill that was passed last night in the Senate and that is headed to the House. As we heard from our distinguished speakers today, nonprofits are on the front lines of working with our communities in this crucial time. And there are a few provisions in the bill related to supporting nonprofits doing this work. And real quickly, the first is related to the Paycheck Protection Program. This is essentially a zero-fee loan of up to $10 million for nonprofits with employees less than 500 people, and about 8 weeks of average payroll and other costs can be converted into a grant from that amount. So the loan that is taken out, about 8 weeks of that payroll can be converted into a grant. And then the principal and interest is deferred for up to a year, and all borrower fees are waived. So this is known as the Paycheck Protection Program. The other option for nonprofits that was passed last night is known as the Emergency Economic Injury Disaster Loan. And there are two features here that folks should know about. The first is that nonprofits can apply for an advance of $10,000 for the loan, and they get to keep the $10,000 if a larger loan amount is not approved by the Small Business Administration. So what does this mean? A nonprofit can apply for this disaster loan for up to $2 million, and it does have an interest rate of 2.75%, but SBA will advance $10,000 of that loan to the nonprofit within 3 days, and that $10,000 can be converted into a grant, that first $10,000. Also, there's been issues related to how the funds can be, the guarantees of the loans. And so the bill includes a waiver that a loan amount of up to $200,000 by the nonprofit, there's no loan guarantee requirement from that nonprofit to provide collateral. These can be used in combination and subtracted from the Paycheck Protection Plan, but there's a lot of work related to the complexity around SBA application and loan programs that may be a barrier for nonprofits, because the loan applications are set up to respond to a small business and not necessarily to a nonprofit, and ask questions that may be more relevant for a small business rather than a nonprofit. So those two items were passed last night and adopted, and it's now headed to the House. And then the final piece is related to an above-the-line charitable deduction of $300. That is not certainly what we asked for. We asked for more, but that's what's in the Senate bill. So that was the quick update, and I'm gonna turn it back to you, Katie.
And is it fair to say that there either already is or soon will be a write-up of everything you just shared on the Philanthropy California website?
Yes, it's being worked on right now, and
okay, great.
It will totally go out to everyone and will be posted for folks. It will also contain larger provisions about where the money is going to programs. So early childhood programs saw funds, housing programs saw funds. The big question that all of us are looking into is where will the money track, how will it flow, and who will it go to? And that's really up in the air right now as we wait for implementation language and for the agencies to receive these funds and set up the procedures for that.
Great, thank you so much. Our public policy team will be working fast and furious on that write-up today, I know, and if you weren't able to furiously scribble notes, as Sayron was sharing, we'll have that available as a resource to you very soon. And like I mentioned, we'll do a deeper dive on public policy on a future one of these calls. So now I'm going to transition to our Q&A section. Thanks to all of you who have been submitting questions in the chat box. The first question goes to Michael. Folks are wondering about volunteering. I think there had been concerns that food bank volunteering had dropped off, which you mentioned, especially larger, maybe corporate volunteer bases that are now working from home and not able to be out in the community. But you said you're noticing a slight uptick again with folks looking to fill their time. So can you just speak more to volunteer needs, and if folks are interested in volunteering, is that a possibility?
Sure, glad to answer it. And I think I saw part of the question. If someone wants to volunteer, you can just go to our website, lafoodbank.org, and all the information is there. Volunteers, correct. We saw immediate drop off. Our volunteers come from corporate groups, from universities, high schools, civic organizations, religious organizations. So it's good we don't rely on one particular source for volunteers, but we did see a lot of corporate cancellations, again, as businesses have closed and probably being worried, and I think one thing that I think is an issue globally a little bit is around liability and liability issues. So that's kind of a separate topic, but for some of you who looked into that, a lot of insurance policies actually exclude this type of situation. So I think that's, appropriately probably freaking a lot of people out in terms of, what will be covered as this situation continues to evolve. But back to sort of the volunteerism, we are having volunteers come on site. They're asking questions of, what steps are we taking on site to ensure that, again, we're fortunately at this point, we don't have anyone who is tested positive. Or anyone we're aware of that may have the virus. So we're, again, following the public health guidelines on site. It's actually reduced the number of volunteers we can have because volunteers can't stand side by side. They need to be 6 feet apart. And then we're seeing actually a lot of volunteers helping us at our distribution sites. These are the drive-through sites I mentioned. Our senior sites are continuing. And then we'll be asking for, again, volunteers for the LAUSD. And that actually is an offer to any school district in LA County. We have been in discussions with Inglewood, and we expect other school districts to contact us now that, again, school closures, it's more clear what's going on there. I think we're seeing, actually, talking to Anna Martinez yesterday about it, we're seeing a lot of people from the entertainment industry because everything's come to a standstill there, right? So kind of interesting. So instead of kind of groups, we're seeing a lot more individuals, and again, people making that decision that, yes, I'm worried about what's going on, but I just, I'm climbing the walls. And again, it's an essential service. That doesn't mean we ignore public health. We have to follow all those guidelines. But given that the distribution of food is viewed in that fashion, we are accepting volunteers and placing them.
Thank you, and really heartening to hear that folks are using their time in that way. The next question is for Javier, but I wonder, Michael, if you might want to touch on it as well, related to personal protective equipment. So Javier, someone asked, on another briefing, I heard that attorneys and family members of detainees are required to have masks and gloves if they want to visit. Is there anything that can be done there that doesn't take supply away from first responders? So I'm also curious, just more generally, we hear about this lack of masks and other equipment, and are either of you seeing that, facing those shortages? If so, how are you combating that? So maybe Javier and then Michael.
Yeah, so for us, we know from the Adelanto Detention Center, there are no visits at all. So families cannot even visit their members, even if they have the protective, protective gear. They're not allowed to go inside of the detention center. For attorneys, they're allowed to go in because it's, the right of someone that's detained to be able to see an attorney. However, it's also limited. So right now they're doing it through, there's the glass, and then there's also 20 minutes at most that they can actually see their attorneys. Before they were able to see them, for hours if they wanted to on their cases. So that's what we know that. So they're not, at least for the Adelanto Detention Center, they're not allowed to visit their family members. We also know that from the calls that we get from folks that are detained, that the staff is having an issue where they don't have enough masks even for the staff of the detention center, and that creates concern with the people that are detained, because they're like, we're detained, we're not going anywhere. Folks that are working here are going out in the community, and they might bring something back into the detention center. So that's what we know around the detention center in Adelanto.
Thank you. And one thing to Javier's earlier comments, I just want to mention is, on an ongoing basis, the food bank and the agencies we serve anyone who comes. So that's the case on an ongoing basis. And what I mean by that is, regardless of being documented or undocumented or whatever the case may be, that question is not asked in normal times, and it's especially, of course, not asked during this time. And there is support for our type of programs from all levels of government to operate in that fashion. So I just wanted to mention that. Masks are very hard to come by. We have not to date put any orders in. We are searching, just because we are, again, want to be prepared as, unfortunately, the transmission of the virus grows, but we haven't wanted to take anything away from the health providers who haven't been able to have enough masks, unfortunately. Gloves aren't a problem. Sanitizer, we had enough in inventory, so that's been okay. We are providing gloves, and there's sanitizing stations around, but there's nothing better than washing your hands, is what we're all hearing. So that's better. And again, CDC is really, their guidance is for people who are healthy, don't need to wear a mask. So I know different countries, we're seeing different sides of that, but we have, for some of the volunteer groups, I've seen not the N95 mask, but a little bit more of a basic mask, and a little bit protective shield provided. So again, I don't think that's really impacting. That's not really what the health providers really, frankly, need. But at least gloves, hand sanitizing is available. So that's good news.
Thank you. Our next question might be to the two of you as well, although Anne, maybe CCF is doing some work around this that I'm not aware of, so feel free to chime in. But the question broadly is that some of these systems to access resources and support are complicated, and actually, Sarah, on this might go to a policy question as well. All of these support systems are complicated to navigate in English, let alone if you're a non-English speaker. So Javier, you mentioned maybe doing your own kind of 211 day and promoting it on the radio as one great possible solution to this. But what kind of resources are there, especially for non-native English speaking populations, to access all of the support that you all provide and that's out there?
So I'll speak on what, on the Inland Empire. I will say I'm sure we reached out to 211. I think they do have, obviously, resources. They do have folks that speak Spanish, the one in the Inland Empire. However, there's not enough capacity, right, for that. And so that's why we had this idea. One of the ideas is also possibly just teaming up with them and doing it through their system, right? And just saying, funnel channel costs through us, and we'll be able to support that way. But what we've seen is just the best list that we have are the ones that our community organizations are doing, where they're getting from all the resources that are out there, and then they're just being able, just translating them into Spanish. And so that's what we have been doing, just translating into Spanish. And then we're also want to translate it into other languages. However, we have also, we don't have the capacity right now to be able to translate into more languages, but that's also in the works. So for us, we can send our list to you out. It's very specific to Inland Empire, but we can definitely do that and send that your way.
Okay. Yeah, I'd like to add to that. Thanks, Javier. And I think he's raising a good point. I mean, especially with this time of uncertainty, I think it's a really, this is where community-based organizations are really important, because they're, for some communities, are going to be more the trusted place to go, and the trusted partner. And again, even linguistically, you're people who can, again, speak, this is across the board, not of course just Spanish speaking, but across the board with the tremendous diversity we have throughout Southern California. So I think Javier is raising a really good point there, because again, both language and culturally and sort of comfort, I think is really important. I do think there's this overall issue around, I mean, I've lost track. I've seen different numbers of how many languages are spoken in Los Angeles County. It's well over 100. But when you look at sort of public benefit programs, and another hat I do wear is I'm on the Commission for Public Social Services as Supervisor Hilda Solis's appointee. And we spend a lot of time talking about this with regards to CalFresh and other programs. And some of this is state driven, some of this is locally driven. But again, for counties, they are in benefit programs, and in healthcare too. I'm just not as knowledgeable on the healthcare side. It's a lot of focus on, again, what I mean by threshold languages is up to a certain level, there's a number of speakers in Los Angeles County, thus translation services need to be provided. And not just verbal translation, but materials need to be written in those various languages. So anyway, there's a focus on that, certainly, especially for government programs in normal times. And again, this whole situation is it's just shaking everything up, right? And I'm not surprised to hear there's some gaps and concerns there. That again, I think we need to evaluate and see how best we can to deal with them. But for the immediate time, I'd say, again, CBOs serving specific communities are really key right now.
Great, thank you.
For the
and I'm going to have, oh, go ahead. Yeah, go ahead.
So sorry. For the loan programs that I described earlier, the bill last night did include money for the SBA to translate them into the 10 most commonly spoken languages other than English, which includes Spanish, Mandarin, Cantonese, Japanese, and Korean, as well as Vietnamese and Tagalog for the bill's coverage. Obviously, that's not inclusive of the many other languages spoken here in California that Michael referred to, but there was $25 million set aside for the SBA to translate these loan agreements into languages other than English.
Thank you. I'm going to have our last question. We have about 2 minutes to answer, and then I'm going to switch gears to updates. Some of you have been sending updates into the chat box. Thank you so much. I'm going to read those out so that they're so everyone can hear them. But I'm going to ask one more question to Anne. You mentioned policy and advocacy as being really critical, and I'm wondering, and those who are tuning in are wondering about how nonprofit organizations are doing with relation to advocacy and surfacing their needs to you. It feels like folks are just barely trying to cover bases right now. So do you have a sense yet of how nonprofits are doing advocacy and what their needs are? Are you hearing from nonprofits as to what they would like funders to be advocating on their behalf? Or have you been having those conversations with grantees about advocacy more generally? Or has it been more focused on just really immediate response right now?
Thanks, Katie. I think it's all of the above. You're right that people are, I'm very aware of how precious the time of people like Michael and our grantees who are actually still at work providing services, so trying to be careful with how many times we landscape scan them and ask them what they're thinking about, not only immediately, but into the future. But, so some of the, my main area of expertise is in housing, for instance. And, I know that many of the supportive housing and affordable housing providers are already thinking, uh-oh, I need to talk to my bank about the fact that people are not going to be able, even people who are paying affordable rents are paying some rent, right? They're paying, $600 a month, $800 a month, whatever it is, and they just lost 90% of their hours, and they're not going to be able to pay the rent on April 1st, or not going to be able to pay all of it. And so how much of that is the tenant's problem? How much of that is the apartment owner's problem? How much of that is the bank's problem? And, so people are starting to talk, and the banking regulators, amazingly, very quickly on Monday put out a notice to all of the banks that they could, restructure loans, take unpaid, mortgage payments from apartment owners or homeowners, move them to the back end of the loan, do things like that, and not be considered to be, not have to treat those loans as, being in default and as a problem that needed extra reserves against it. So, and Fannie and Freddie moved quickly to say, for instance, that in order to do that, you had to have the borrowers not be evicting people. So those benefits had to flow through to the renters. So sort of, I guess one way that we work a lot on advocacy issues is trying to be a bridge and, share information out and then gather information about the problems. And so we've been doing a lot of work talking about that with people and some of the bigger issues going forward. Around the health clinics, I think the same, issues coming up, for instance, about telemedicine, and is that, reimbursable under Medi-Cal, and that people move very quickly on that and with good results. But it's not systemic yet. I think there is just, as problems come up, people are trying to envision how these problems will last over 6 or 8 or 12 months. And so I think it's just the usual kind of iteration that we see in a lot of policy work. And we'll have to figure out how to see that become a little more systematic so that we can really get all the issues out in the next several months.
Great. Thank you, Anne. And thank you to each of our speakers so much. You are all a wealth of information, and we're really grateful for your time and what I know is a really busy, incredibly busy time. So now I'm going to transition. We have about 3 minutes left. Hang with me because it's going to be an important 3 minutes. I have some updates from SCG, and then some of you have shared updates in the chat box that I'm going to share back with the group. So first, as I mentioned, SCG is coordinating deeper dive conversations in between these Thursday weekly calls if folks want to talk with specific subsets of the membership. So for example, this Monday, March 30th, my colleague Jessica is supporting a Ventura and Santa Barbara regional funder call. So if you're a funder in those regions or you support grantees in those regions, feel free to reach out to my colleague Jessica to get plugged into that. She's also coordinating a call just for our corporate members to talk about the unique aspects of being a corporate corporate grant maker and responder to all of this. That's next Thursday, April 2nd at 10:30 a.m. Similarly, my colleague Morgan is supporting the LA Arts Funders Group, who wanted to come together just to talk about the issues that artists and arts organizations are facing right now. So all that to say, we are happy to host these types of deeper dive conversations if you feel like you want to talk to your other grant making peers in a specific geographic region related to a specific issue area for a specific subset of grant making. We want to be as supportive as possible as SCG to provide that platform. So if you would like to have those deeper dive conversations, please be in touch. My email is Katy, K-A-T-Y, @SoCalGrantmakers.org, and happy to plug you into the right places or just hear what you need. And if we aren't already coordinating around it, we're happy to see if we can provide that type of support. So in the chat box, others are posting, and I'm going to just summarize. You know what? I think I will, because we only have a minute left. I will just transition all of these resources. Folks are putting in links to 211, and there's a fund in UC Riverside, Community Foundation and UC Riverside are hosting an information hub. Folks are posting lots of great resources. So I'm going to recap them in our follow-up email so that you all just have those links. The last thing I want to say is that we are hearing from you all two things. One, that folks want to know what other funders are, how other funders are responding, these are good deep dives, but it would be helpful for our members to know what type of grant making is happening to the extent that you've decided. And then two, many of you are surveying your grantees or thinking about surveying your grantees about their needs. And as Anne mentioned, that is such precious time. It's also such valuable information. So as SCG, we're going to try an experiment. We're going to ask you if you have surveyed your grantees and you are willing to share the data, either in aggregate, or we can talk about, I'm happy to think through confidentiality as much as possible. We would like, as SCG, to support an aggregation of data from both our members related to your grant making, and then also from your grantees. And over the next week, we are going to take what you give us. I would love to be inundated with information, but we'll see what folks have. And we have a team at SCG that's going to spend the next week compiling that data, if you're willing to share, and then sharing it back at the very least a high-level synthesis of what folks are doing in Southern California and what needs they're hearing from nonprofit grantees in Southern California on next week's nonprofit call. So the survey that is going to pop up in your screen as soon as this webinar ends is going to ask you some basic questions about your grant making. It's also going to ask you if you have already or you're planning to survey your nonprofit partners. And we would love to, we're kind of, as all of you are, we're figuring this out as we go. And we would love to help be a clearinghouse so that we have more transparency across grant makers and are using our grantee and nonprofit partners' time, as precious as it is, using it effectively and sharing what they're telling us they need with each other to the extent possible, so that they can keep doing their really good work. So those are two experiments we're going to try, is collecting data from you all on what you're doing, and then collecting data on what your grantees need if you know that information. So this survey that will pop up is the way to start giving us that information, or feel free to reach out to me by email, Katy, K-A-T-Y, @SoCalGrantmakers.org. So with that, we're just a minute or two over. So I want to thank each of our speakers again so much for your time and your work, and the almost 130, 40 people that joined us virtually to engage. We will have a follow-up email going out with a recording of this webinar, as well as notes and all of the resources that you all shared in the Q&A. So thank you again. We will be back next Thursday, April 2nd, from 9 to 10 a.m. to talk about nonprofit resilience. And until then, please take care. Thank you.